Hello, thank you for joining my YouTube channel today. I'm going to talk about the UK public health application through the non-medical routes. And this is because most of my colleagues who are going through that route have requested that I do something for them to support them with the application. And that's why I want to do this. So you're welcome. If this is your first time of joining us, nice to meet you. And I do hope you find this video very useful and helpful to you. But before you go on, please try to subscribe to my channel and also give us a thumbs up so that this video can reach more people. Okay, thank you very much. So we will go to um, the topic of today, which is to walk step by step the application process. I mean, how to fill the application form for the non-medical routes. So if you're going through the GMC, which is a medical route, it's pretty straightforward because you've got no essays to write. You just have to fill in your details and submit your request form. But for those of our colleagues who are going to apply through the non-medical routes, there's more to do. And that's why I'm doing this video. So I will now share my screen so that you see a sample that has already been put out there in open space. And I'll talk you through what you can do and how to fill in those. And also to show you at the end of the video, so if you watch through the end, and updates for other colleagues who may not have to write it. So let's go on. I'm going to share my screen now. Okay, so let's go to share my screen. I hope you can see my screen now. So let's go on. I'm going to start from the beginning. So this an example application. So like I said, it's there on NHS England and Health Education website. So you can look up this for yourself if you're in doubt. So for the application, when you want to apply, you know where to go to. It's Oriel. If you haven't used that link before, website before, you would have to register first. So Oriel is the platform for all the specialty registrations for application registration for UK specialties. So public health is one of those clinical specialties that apply through Oriel. So if you get to Oriel, register and search for public health, it will pop up the public health application for you because this is the window of application. So it's active. And when you start your application, it will usually give you option to either apply to the medical or non-medical routes. So whichever option you choose will determine the form that will pop up. So for the non-medical routes, a form that will ask you questions like this will pop up. So, and what the form seeks to assess will be your eligibility to apply for the program. And those will include your qualifications, your primary qualification, which usually will be your BSc, expected to have at least a 2-1 in your BSc. Otherwise, you need to evidence higher degrees such as master's or a PhD. And they will give you opportunity to fill in your qualification, the degree, date of certification, and other things, details, as you can see on the screen. And if you're including master's or PhD, similar things will be given to you to sort of fill in. So different spaces or options will be coming up as you're filling. After that, the next thing to fill up will be your employment history. Remember, in the eligibility criteria, you're supposed to have at least for 8 months of experience, and 24 months of that will be at the level of band 6, and will have a public health relevance. So you need to enter the work you've done, and they have also given us opportunity to fill it in the order they want. For instance, you have to put in your employer name, say whether it's full-time or less than full-time. Less than full-time means part-time. So, and the start date, end date. When you add that, you include another one. So you have options to fill in a lot of things you want to put in terms of your employment. So you see, for instance, this person had included their job from 2001 2007 to 2018. That's pretty long, almost 11 years of job experience. But thankfully, you're only expected to evidence 4 years of experience in the last 2.5 years before the commencement of the job. So you also have to let them know if you have had employment gaps. So when you were not working, so that could be maybe when you're doing an educational program, master's, PhD, or you're on leave, or anything at all that's made you not to work. So you need to evidence that. Other questions that you need to say yes to if you must progress. I mean, if you will be shortlisted for the assessment center, will include to say yes to having worked for 8 months, or you would have worked for 8 months, and also that of 24 months uh, employment as agenda for change band 6 or equivalent. So this is important because this equivalent, let me try and okay, so I've highlighted it. So this equivalent means that it doesn't have to be in NHS, but you can sort of demonstrate you've worked at the same level. At band 6, you are um, sort of mid-level. You're not just at entry level, and you've got some leadership roles. So if you're working in any setting, whether it's in the UK or outside the UK, and you've got people under you, you've got a team, and some some colleagues under you that take a bit of instructions or report directly to you, so you can let's say your job role is at band 6. Why this is important is because I don't think there's any other way to really measure that. If you want to do salary equivalents, the band 6 in the UK might really be um, getting a higher salary than a senior person in other countries because of the differences in salary scale. So you need to write a presentable narrative while saying the real truth about it, though. Okay, so the next question is about, do you wish, please specify which posts you wish to count as 24 months general work experience. Remember, it's for 8 months entirely, but 24 months of it will be general work experience, and the other 24 months will be the agenda for change, band 6 or above level, and work that is relevant to public health or population health. So this person had included this. Then the next question is about, please specify which posts you wish to count towards your 24 months population health relevance experience at band 6 or above. The candidates here, for instance, had evidenced this. So you can include anything really that will give you that level of banding that you expected to have for it. So if you've worked for, say, 4 years, so the first 2 years really usually will be maybe in a lower row if you choose to use that. Then the other row will be at least at band 6, and you should be able to say exactly what you did. So that takes me to the last question. So where I said, please describe in a detailed paragraph up to 200 words how this experience relates to population health practice. So you should be able to say, this is what I do, and this is how it improves public health. If you're working in a health improvements setting, say it's improvements in obesity, improvements in uptake of immunization. So for instance, if you're working in outside of the UK and you're an immunization nurse, so that's really a brilliant work to put in there. That uptake of immunization is very important for the population. You remember herd immunity. So when everybody has taken up their vaccination, you're able to protect the vulnerable who are not able to, or those who for any reason are not able to do that. So whatever you're going to say, please relate it back to population health. And remember that you are not just there to say, this is my role, I'm a senior health officer, without saying exactly how it relates to public health or to population health. Okay, so I'm going to just share another screen for us now to talk about an update to this last part where before everybody used to write this, but in this screen I'm going to share now, So this is the frequently asked question page from NHS England, Health Education England, actually used to be Health Education England. So so this is question 21 from their frequently asked questions. You can easily go online and check frequently asked questions, public health training. It will pop up this page for you. So, but what I am trying to draw your attention to is that it says specific advice cannot be given, but applicants applying via the non-medical routes who are not registered with Nursing and Midwifery Council or the Health and Care Professions Council must provide a detailed paragraph of between 100 and 200 words that describe why you believe the employment you wish to count as the required criteria of 24 months at agenda for 10.6 or above is relevant. So before, everyone used to do that, at least what I knew before. But now it does appear that folks who are registered with NMC and HCPC are no longer required to evidence these 200 words, which is a good thing. So it removes one layer of barrier from you. So if you're up to band 6 and you've done that for 2 years, you don't need to write so much essay to get shortlisted for assessment center. So that is what I was hoping to share with you, and I hope this will be useful for you. And if you do have any question, please ask. And if there are other things you would want me to talk about in the course of this recruitment round, please pop that in the comment section and I'll pick that up and discuss that later. Before you go, remember that we're going to be doing some teaching sections around principles to respond to random questions, waxing glazer, and situational judgment. So this will be happening in subsequent weeks. So peel your eyes and watch out for that. And please subscribe to our YouTube channel so that this can go around to everyone that needs to know about what we're doing. Thank you very much and see you in my next video. Bye for now.